Thanks, Adam. Dr. Michael Kuhlenschmidt from Christie Clinic is here to make the rounds this morning. Good morning to you, sir.
Good morning.
So, we got a nice spring forecast. Finally going to get a little warmer outside. But, it's that time of year when a lot of flowers are blooming and people are starting to sneeze.
That's right. So this is the Asthma and Allergy Foundation of America's Allergy and Asthma Awareness Month, so the month of May. Primarily because of what you just said. This is the time when people are starting to feel the effects that have the predisposition to asthma and allergies. So I look forward to this time of year every year because
look forward to it.
Absolutely. We're not for the asthma and allergy part, but because the weather's getting warmer, right?
Yeah, yeah, of course.
But a lot of people don't, and because they do have this significant disease that affects their life, so allergies and asthma is really common. 60 million Americans are affected by these conditions, and about 30 million Americans have asthma of varying degrees, but it can be a very significant disease, and it's a very, very costly disease for the country.
Sure. So I guess my first question about that would be, how do you know when you have allergies that are bad enough that you need to do something about it?
Yeah, sure. So I think a lot of people are familiar with the symptoms of allergies. The runny nose, sneezing, the watery, itchy eyes, especially after you're outside and exposed to those things. So those symptoms are hard to miss. But there's a connection between the same thing that causes allergies causes asthma in those people that are predisposed, also causes skin conditions like eczema. Sure. And so it's really the connection between those and asthma, which can be quite serious. But allergies alone can be very life-limiting.
Yeah, very good. And so, how do you know when maybe it's time to take medication or something over the counter?
Absolutely. So with a lot of things we've talked about, prevention is the key. So if you can identify those things that you're allergic to and avoid them as best you can, that's great. That's the best. But sometimes it's grasses and pollens, and I was outside in my backyard 2 weeks ago, and it was just pollen everywhere, dust covering all the surfaces. It's unavoidable at times.
Yeah.
So in an effort to be able to be outside and enjoy your life, if your symptoms are limiting to the point where you can't do that, that's the time to act.
So that's really the barometer. Is it affecting your life?
Absolutely.
Very good. And of course, this month is all about awareness of this. What can we think about this month to kind of help the people in our life who are experiencing some of these symptoms?
So there are a lot of treatments for seasonal allergies and for asthma. And oftentimes, it just takes having those conversations and seeing what's out there. Everything from medications that can be used as needed to daily medications to allergy shots, which are, immunotherapy to try to prevent or, reduce the need for medications and, prevent this from escalating. The other thing is that asthma is a serious condition. Asthma affects about 8% of the population, and it can be mild from, I used an inhaler a few times when I was growing up, to I'm in the hospital multiple times a year for this condition. And so it's all about prevention and having a game plan with your physician about how you're going to recognize the symptoms and get treated properly.
Gotcha. And of course, if you've experienced symptoms that are severe, it's important to find out what exactly is causing them. That can be tricky sometimes.
Absolutely. It can be tricky, but there is testing that can be done. There are specialists, but it really is a condition that can't be cured, but it can be managed as long as you're, proactive about it.
Right. Very good. All right. Dr. Kuhlenschmidt, thank you so much.
Thanks a lot.
We'll be right back with more of The Morning Show right after this.